Any practitioners who've been part of a well-functioning tumor board will tell you that this makes their job easier.
And I think the evolution and refinement of these in recent years has been one of the most important breakthroughs we've had in caring for cancer patients.
People coming together in teams who bring a variety of skills and knowledge to best decisions for patient treatment.
We have seen numerous occasions where the plan from a solo practitioner, well-intentioned, is modified dramatically by the input of a multidisciplinary team.
When I first met with the patient, I had indicated that this probably isn't going to be a curable situation. Coming out of the MCC discussion was that we actually agreed on a plan that would potentially cure this patient.
Working in a rural hospital, one could feel isolated. Attending MCCs allows me to feel connected to our medical community.
It gives the community urologists an opportunity to present their patients directly to us, and that has meant often faster access or fast tracking of patients to get them in if there's an urgent condition that needs our attention.
I know more about how difficult a pathologist's job can be than I ever did before.
The pathologists at any MCC play an essential role on integrating and many times translating knowledge to clinicians. That's why I think it's time for us to get out from behind our microscopes and be directly implicated in cancer care.
I think there really are benefits for the radiologists. Not only do they see that where their reports need to be very specific and which items they need to stress in their reports, but also the rounds give them an opportunity to get some follow-up on patients.
Nurses and allied health bring a different perspective to MCCs. Our role is to speak to patient issues such as emotional, family, and socioeconomic factors that may impact patient care management.
I think we all derive a lot of satisfaction and a lot of confidence in knowing that we're bringing the best care back to our patients and that we're supported by our colleagues.
As the burden of cancer rises, more patients
will need to be discussed at an MCC. Each region
has made tremendous progress in making MCCs an integral part of cancer journey.
We can all work together
to improve
the quality of MCCs across Ontario.